Hello to all the friends and the viewers who are joining us today here at our session at VARIJA Life. For all those who don't know, VARIJA Life focuses on creating awareness for people with physical and mental special needs. And as part of our other initiatives, mental health and prevention of mental disorders has been our focus for a very, very long time. So today we thought we'll have an interesting session which is much awaited and much needed in current times, and we have a very eminent panel that has joined us today. But before that, I thought let me just do a little fast check about what is happening in India about mental health. We all have been talking about it. We all have been urging our friends and families to seek help, but how many of us really know what mental health is all about? So a few fast checks. Did you know that 1/5 of the Indian population at some point of their life do face depression? And it is imperative that they seek help when they do go through depression, and only 10 to 12% of that population actually seeks help, which is a very, very small figure. Surveys have also revealed that when people are asked about mental health, about 87% people do know what mental health vaguely is all about, and about 71% people relate it to terms which we would relate to stigma. So they would say that, people with mental health issues, they're probably crazy, pagal hai, they are mad, they're probably spaced out, they are daydreamers, they are forgetful, they are irresponsible, they are careless. Those are the terms that we relate to people with mental health. But is that a myth or is that a fact? We will find that out today. And it is because of the stigma that the people who really find it imperative or really want to seek help don't really do so, because they feel that they'll be labeled as pagal, right? So the attitude of people uh, actually uh, deters anyone who is wanting to seek help to go to a psychologist or go to a psychiatrist or a therapist or a counselor, right? And according to WHO, very startling figures, according to WHO, we have one doctor or a one psychologist to 1 lakh people in India. And again, according to WHO, 6.5% population needs doctors and psychologists. So we are actually looking at one doctor to 6,500 patients, 6,500 patients today in India who actually want help. And that's the disparity. So how many people, one, are they reaching out? And even if they're reaching out, are they getting their problems sorted? Are there enough doctors? I think that's a big question that one needs to address. And we have a very eminent panel today who have spared their time to join us today to answer your questions, my questions. I have too many questions, and address issues and myths which revolve around mental health. We have Dr. Narendra Kinger, who has joined us today. He is a clinical psychologist and a psychotherapist. Apart from being the founder and trustee of Talk to Me NGO, which focuses on mental health, he is attached to several hospitals and nursing homes in Bombay. To name a few is Sir H.N. Reliance Hospital and Holy Family Hospital. He has also been on the panel of Air India as a clinical psychologist. Apart from doing assessments for workforce of various organizations, one that impressed me the most is the one that he did for 1800 Mumbai Police Force, in the country. So welcome, Dr. Kinger. Thank you for joining us today at this session.
Hi, Varija.
We
thank
have,
you very much.
Thank you, Dr. Kinger. Next, we have Preeta Basu. She is a social psychologist and a psychotherapist. psychotherapist who's been extensively working in the area of HIV, AIDS, and substance abuse. She has also worked in assessing stress levels of frontline workers and counseling them. Very, very imperative at this point. Thank you, Preeta, for sparing time and joining today at this
Thank you,
session.
Varija, for doing this.
Thank you. And we have Sindhu Upadhyay. She is a psychotherapist who has been trained by the Beck Institute USA, who has been focusing on mood affective and anxiety disorders. And she's making herself accessible to clients who prefer online therapy, even more important right now. Thank you so much, Sindhu, for joining us today.
My pleasure.
Now, Dr. Kinger, I want to ask you a question, and a question which is uh, which lot of people, a layman, would probably want to ask is that what is stress, depression, anxiety, mood disorders? We hear all these terms, and more so even now during COVID times. Uh, are these all terms which need to be addressed by a doctor? Because it's considered in India, it's considered stress hai to sabko hi hota hai, what's such a big deal? Everybody has stress. So are these clinical? Do we need to seek a doctor? Which of these are clinical? Would you like to throw some light on this?
Yeah, Varija. So stress is a normal part of life. Everybody experiences it, like you said. But when we talk about stress as professionals in the mental health field, we're actually looking at whether you're able to cope with your stress. So everybody has different stresses. Children have the stress of exams. Teenagers have the stress of career. Older people have other stresses. Old people have the stress of death and dying and losing their capacities and capabilities. So different age groups have different issues which they struggle with. For us, or as professionals in the field, it becomes an issue when a person is unable to cope, or when he feels that the amount of stress is keeping on multiplying or increasing, and as a result of which their day-to-day functioning gets impacted. Now, whenever stress becomes too much, the person's thinking, emotions, and behavior do get impacted. And that's when a mental health professional comes into play.
Sure. I would also like to bring in Sindhu here. Sindhu, if you could answer that, what is that time, as Dr. Kinder said, that, there is a stress that everyone faces, but there is a point that you decide that, no, at this point, I need to see a mental health professional. What is that point that we need to draw a line that, okay, now this is it, I can't handle it by myself? Because all of us, we tend to test our threshold levels and we feel, no, we are strong enough, and we don't want to feel vulnerable with the thought that, no, I can't handle it, I need to see a doctor, and somewhere that thought sinks in. So how at what point do you think one needs to see a doctor?
So I would definitely say that, stress, when it starts to turn into a stress disorder, would bring certain attributes and characteristics with it. You would suddenly find yourself increasing the duration of thinking negative thoughts, the frequency, the intensity might change. So we are looking at duration, we're looking at how much are you deviating from your normal everyday behavior and work schedules? How much is it interfering, therefore making daily functioning difficult? So is it becoming dysfunctional for you that in the presence of such monumental stress, you're not able to do and carry on everyday tasks? Then are you at any point, are you are you thinking or contemplating self-harm, or are you a danger to yourself or to others? Like Dr. Kinger rightly said, stress happens to all of us. It's when a clinician is diagnosing it to be a disorder, they're going to use a set of tools to find it. They're going to be focused interviews, they're going to be a set of questions, we're going to look at the history. So, not every stress is a stress disorder. It's a normative experience for a lot of us. It's only when it deviates, becomes dysfunctional, carries on for too long, and it begins to interfere with what you are hoping for in the future. That's when we would call it a stress disorder.
And at what point do you, uh, I mean, whom do you really reach out to? Do you reach out to a psychologist? Do you reach out to a psychiatrist? Do you reach out to an individual or a physician or a hospital? Who is?
Anybody, the simple answer to that is actually you begin by being aware of what's happening first, and then you reach out to a friend, a relative, who might direct you to a counselor or a psychologist. If you feel that you've not been sleeping okay, if there is more fatigue than usual, if there are changes in your diet, if there are certain sort of somatic interferences like body pain and unexplained weight loss or weight gain, go and talk to a GP. In India, we have a biomedical model, and that sort of healthcare model makes it very easy for a GP to refer a patient to, say, a psychologist or a psychiatrist. You go to a GP and he takes your history and is able to assess, and there are a lot of underlying
So
conditions he has to explore.
GP here is
General practice, yeah, a physician, your family doctor, the
yes.
first contact.
Okay.
You could also go to a psychologist, because a psychologist would be able to evaluate, identify, and assess. And at some point in time, if they feel the need for, say, medication, they would refer you and guide you to a good psychiatrist as well. So,
Okay.
accessing help matters. Start
Right.
anywhere, start talking.
I,
That's
I
very important.
I'll bring in Preeta over here because for a layman, psychologist and psychiatrist are synonymous. But I think our viewers here would actually want to know what is the difference between the two and whom should you reach out to as your first point of contact.
So, very good question, Varija. There is a lot of confusion about who's a psychiatrist and who's a psychologist. So, I think both a psychologist and a psychiatrist deal with mental health issues. Both will talk to you about your mental health issues and aim at solving it, or aim at directing you to manage it better. A psychiatrist is capable of giving you medication, and a psychologist is able to do the testing and diagnosis of that mental health issue. So it's a very clear difference between the two, but at the same time both of them work in unity. That means they both are going hand in hand and they're working together to help you out.
So are you saying I need to reach out to both?
Not necessarily. Like Sindhu and Dr. Kinger over here would agree with me that your family physician would be the first entry to asking for help. So if you have things like, I'll give you a small example. If you're not sleeping well, you are not eating well, you are not feeling happy, in spite of the fact everything is going fine, there is an underlying condition that is developing. And we would probably say, okay, you're feeling depressed, at a very mild level. So you go to your physician and say, I am not feeling well. This is what is happening to me. And he will say, okay, seems like you need to talk to somebody, or you need to see somebody, or somebody needs to evaluate further than these basic feelings. So would you prefer going to a psychologist, or would you prefer going to a psychiatrist? Now this is a choice and a willingness of an individual to take on. Because think about it, Varija, I mean, if I have an illness, I choose which doctor to go to. If I am open to certain kind of therapy, for example, I have knee ache, so should I go to a physiotherapist, or should I go to orthopedic? So this is like a difference that I can give a very layman term to explain it to you. So you choose, you have the willingness, you choose that would you like to see a psychiatrist who may recommend medication? Are you willing to take the medication? Are you going to stick on with it? Or would you like to go and speak to somebody, talk your feelings out, and do it without medication, and stay in therapy or counseling to work your problems yourself?
Yeah, Sindhu, you'll have to unmute yourself.
Okay, I want to also add here that a clinical psychologist like Dr. Kinger, once he is evaluated and found, say for example, a patient to have manic depressive disorder or schizoaffective disorder, it is then imperative and it's a part of the treatment plan to get the client or the patient on medication. So sometimes it's not a choice only. So you need medication. It's a part of adjunct therapy where medication as well as therapeutic interventions go hand in hand. So a good psychologist would be able to assess, identify, then refer to a psychiatrist who would then start the treatment. So medicine as well as therapy would be running parallel. And that's like a holistic treatment, and the outcomes are great in such a scenario.
And so, Dr. Kinger, I would like to ask you here that whenever I have visited my general physician and I have told him that I am not getting good sleep, uh, he's not never referred me to a psychologist or a psychiatrist. He's just said, Varija, just I think you need to work less and take stress less in terms of just go out, take a vacation. Is that the normal method of evaluating? Because
Uh,
at many points I thought maybe I need counseling, but my general physician said, no, Varija, you just need a vacation. So is that how it is?
So I don't think it's as simple as your GP is looking at it. I think it depends from case to case. There are people who don't get sleep because they tend to overthink. There are people who don't get sleep because they get anxious. There are people who don't get sleep because they're depressed. There are people who don't get sleep because of multiple reasons. Sometimes there could be a biological issue. Sometimes there could be stress. Sometimes there could be other factors. So I don't think it's that simple. Now, when your GP is kind of dissuading you that reduce your workload or take it easy or go for a vacation, what he's actually experimenting with is whether the change of lifestyle that you're leading will lead to a more positive outcome. So actually, he's actually in a way suggesting a therapeutic thing. Like for us, many times we may ask a client that reduce the number of hours you work or try to eat your dinner early and see if you sleep. Get in for an exercise program and various other soft interventions. So maybe your GP is looking at that. The second thing you need to understand is that in India, many of us do not like to take medications. We are not very keen or very open to taking medications. Most of us are averse because we are constantly worried about side effects. So, in fact, many GPs may hesitate to refer for fear of the fact that it may scare a patient or a client from getting more anxious. So that means if you're getting 6 hours of sleep, when he tells you you need to consult a psychiatrist, you may get 4 hours of sleep. So actually, instead of helping you, he may end up increasing your stress. So I think it's not as simple, but I think it's a very important thing that we have a discussion with our GP, take it further, maybe actually go for a holiday, see if it helps, and if it doesn't help, you go back to him and say it's not helping. And it's better to speak to a therapist because therapists are professionally trained in actually looking at your symptoms and going to a detailed history and all. We almost spend 1 hour, 45 minutes to an hour talking to a person before we reach a conclusion or a diagnosis. So we do spend a lot of time. Okay, so I think that's the way forward.
Okay. And you also mentioned about medicine. So yes, all of us are really averse to taking medication. And do we actually, once we start taking medication, the other fear is, do we become a medicine dependent patient for the rest of our lives? And what are the kind of side effects, if at all, these medicines are prescribed? And in
So
what
Sindhu,
cases these are prescribed?
sorry. So Sindhu spoke about the role of medicine and therapy together. So first of all, like she spoke about psychological testing, there are certain tests which diagnose your condition. So these are international tests; they're used all over the world. So we are not using something homegrown or which I have made in my own head, but these are standardized instruments which are
Right,
internationally accepted. So if I give you a report here, it's accepted in the US in any part of the world. So these tests will pick up A, your problem areas, and B, the severity of the problem areas. So whether you have a mild problem, a moderate problem, or a severe problem. Now, we don't just do the test, we actually sit with the clients post the test and explain to them what the results mean. Because to the client is a Greek and Latin, they do not understand what all those numbers are and all that. So some of them get scared reading all those terms and terminologies. So we actually ease them and explain to them. Now, if it's a mild problem, you may need to take medication only for 3 months. If it's a moderate problem, you may need to take it for 3 months to 6 months to 9 months. If it's a serious problem, you may need to take it for 18 months. So basically, again, it depends on the diagnosis. So there are more serious illnesses such as schizophrenia where you may need to take it for a longer period of time, or bipolar disorder where you may need to take it for 5 years. Okay. And there are other milder things like anxiety and depression where it may just be 6 months, 9 months, etc. So you see, you need to first of all understand what you're going through and how severe it is, and it's based on that. We actually here in India, unfortunately, everything is labeled depression. People who have anxiety are also called depressed. People who have schizophrenia are also called depressed. People who have bipolar disorder are also called depressed. Unfortunately, this is a trend. So because nobody actually sits and educates the patient or the client that what really these different terms are. But I also want to point out here that the younger people who come to us are well read. They are on the internet, they're reading about it, and whatever terms they see in our reports, they actually go and Google and they get a better orientation and understanding. But nonetheless, I think it's the therapist's job or the person who's doing the assessment to explain. Whether they Google or not, that's their additional resource. But many times you have a lot of misnomers on, you have a lot of negative inputs. So I think professionally it's our duty to inform them what it is.
Right. So I would from there, and I just want to extend that question to you, Sindhu. Uh, various terms that Dr. Finger spoke about: schizophrenic, psychotic disorders, bipolar, mental depression, anxieties. Uh, Now, which of these are these genetic? And a lot of doctors do tend to ask, did your father or your mother had anxiety or depression? Are these which one of these are genetic? And is there an underlying condition which is already there from birth, or are there external triggers? For example, I have seen certain people having psychotic disorders at the age of 30 or 35. So was there an underlying condition that always was there genetically, or did it happen due to external triggers? Would you like to throw some light there?
So, one of the thoughts that I have is based on numerous studies that have been done, and they do indicate that genetics and inherited traits predispose you to certain kinds of medical diagnosis or illnesses. Um, Other than that, environment continues to place a huge factor. It's not like that your blood relative had a major depressive disorder, therefore you will definitely acquire it in your lifetime. Environment, nurturing, and the adaptive behaviors that you have will continue to play a very important role. Emotionally corrective experiences throughout life, building a sense of belief, and managing and coping well would obviously offset that sort of a genetic predisposition. But going back to the importance of hereditary factor, studies have shown that there is a link to certain psychiatric disorders and pre-existing genealogy to it. I would like to refer the question back to Dr. Kinger because he is involved in testing, and I'd like to hear your thoughts.
So I think what she just spoke about is largely true. So if you have a first grade relative, that means a parent or a sibling, there's a 50% higher chance that you may end up with a similar disorder. But this also means when I'm saying a 50% chance, I'm also saying there's a 50% chance you will not get it, right? So actually, though it predisposes you, the bigger triggers are a lot of environmental factors, a lot of personality factors, a lot of individuality factors, a lot of temperamental issues, the way you look at life, the way you think about life. So I would say that it is always a complex interplay of heredity and environment. It's not a very simple thing. So people expect simplistic answers, but research is clearly proving that these answers are very, very complex. And even when genes are involved, it is not one single gene. There are multiple genes which are actually helpful to you also, and in the end up and may kind of co interact and create these problems. So we really need to do much more understanding research which is happening before you jump to conclusion. But the thumb rule is, the very reason that your doctors ask you is because if that is a fact in your history, it actually gives us an indicator as to there's a higher possibility that you may have these disorders.
Sure. And Preeta, I want to ask you, since you have worked in the area of HIV, AIDS, and substance abuse, somebody who is addicted to alcohol, or even drugs for that matter. We've seen in the family that everybody else feels that that person needs help and needs professional help, but that person doesn't feel so. So how do you suggest that the family should deal with such a thing?
This is a very, very delicate matter, Varija, and each family members should tread very, very carefully. We have to keep in consideration the feelings of the person whom we are talking about. Very importantly, if you need to talk to this person, for example, I have a father who is an alcoholic, and I need to tell him, but I'm extremely scared of him because he can be abusive. He after and he's in complete denial that he is an alcoholic. I would either try and take professional help if I don't want to tread those paths, or I would try to talk to my father in an environment where he's comfortable in, where he's not threatened. So I would probably tell my dad at a very casual, while watching TV, sit with him and talk to him, and try and see if there is minimal distraction, making sure not crossing our boundaries, making sure saying things like, I feel that you are going through, something maybe stressful, or something is going on with you where you are taking the support of alcohol to suppress that feeling or that emotion. So things like that may help you open the dialogue with the person. And if you think that things are not going the way, or the person is not able to understand, the best way is to withdraw and take professional help.
No, so if you withdraw, when you say professional help, I mean, again, the person, let's say you're talking about the father here, as a child, I may not be able to push my father to go and seek professional help. Because especially with this generation, the previous generation feels कि सिर्फ पागल लोग हैं जो counselors या psychologists के पास जाते हैं. How does one deal with that situation?
So in our Indian culture and in an Indian setting, it is our general physicians who come in handy. Somebody you trust, from families, your entire family trust, your friends trust, and you have right. So I think the to talking about professional help is, approach your general physician, approach your family doctor, approach somebody whom your father trusts or is a confidant. Go away, go around to tackle this issue. What happens is, your father may not be open to dialogue with you, but your father will be open to dialogue with a friend, with a general physician, with somebody whom he can trust, maybe a superior, maybe a boss, or maybe somebody whom he looks up to. And that will help open this dialogue up much easier.
I think that's a brilliant suggestion. So, if you are around, to all the viewers who've just joined us today, we have Dr. Narendra Kinger, we have Sindhu Wadhwa, we have Preeta Basu. They are all clinical psychologists and psychotherapists. And the brilliant suggestion is that if you're around people who are depressed, who don't listen to you, maybe their family members, their friends, and they consider your opinion maybe something frivolous, there are other ways to reach out to them, whether through their general physicians or to people that they would listen to. So if your father is not listening to you, maybe you need to reach out to your dada or dadi, to whom they will probably listen, right? I would come back to Dr. Kinger. So there are times where everything is right in your life. You're professionally, you're doing well, you're earning well, you're uh, uh, your personal life is fine, you're good with children, your children are good to you, so is your wife, and so is your parents, everything's fine. But there might be moments that you're still not fine, you're low, and you can't figure out the reason. What is that? uh, I mean, what exactly is it? Is it again a condition, or does one need help, or is it okay to feel like that?
So, Varija, everybody has days when we feel low. So, I think a lot of people feel low on Monday mornings because they have to go back to work, but that's
Yeah.
not depression. Uh, People like us get all charged up when we want to go to work on Monday morning. That's not mania, right? This is just the way you look at life. I think the point here is that whenever you feel low, you need to ask yourself: is it just a transient mood? That means I'm feeling like this for this day or this hour or a couple of hours, or is it something which I've been feeling for a couple of days? When this couple of days becomes couple of weeks, when this couple of weeks become fortnight, a month, 2 months, 3 months, that's when it becomes a cause for concern. So one of the things which we as clinicians look at is how long have you been feeling this, or how long maybe you've been feeling this but you're not aware. You may have just become aware last week, but when you look back, or when you come to a professional, when you ask you how are you 6 months back, 3 months back, are you interested, are you motivated, are you doing your best, are you eating well, are you sleeping well, are you talking to your friends and family, do you make calls to your friends, is your boss shouting at you, are people saying you're distracted, not focused? So basically what happens is we go into a time frame. So if you are aware that I'm feeling like this for more than a month or more than 6 weeks, that's when I think alarm bell should ring, and you should reach out to a professional. Now, again, see, when we say professional, 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 the point I'm making is you can reach out to a friend and have a chat. And maybe if that helps you get over it and you get some perspective, it's okay. It could be a friend, it could be anybody. But when you think your friends are not able to help you, or your wife or your spouse or your partner is not able to help you, people don't seem to get what or you have no concrete reason to be feeling like this. Actually, like you said, everybody's going fine, everything's going fine, so why should I be feeling like this? So there could be something deeper, and that's when you need to get to somebody like us.
Right. Thank you. Uh, for all those who've joined us here, we have these three eminent people who've spared their time today, and they've also offered to help. For all our viewers, we have in the scroller below, you can see the helpline number. You can fix an appointment with any of them if you wish. You need to seek help, have an initial counseling over the phone. But what I also want to ask is, Sindhu, I will come to you. What I want to ask is, will you be prescribing drugs if I come to you?
I would not be able to. I use therapeutic interventions, different frameworks, thoughts, sensations, behaviors, adaptive practices to make you feel better, to make you live better and more in line with your values. I cannot, am a psychotherapist and a psychologist and a therapist. They would not be able to prescribe medicine. So we are non medical.
Oh, you're non-medical. And
We
how
all
does
three of
one
us are non medical in terms of prescription,
and
writing a prescription.
how does one decide which doctor to reach out to? Of course, we have our comfort factors with our general physicians now, that we think that we realize that, okay, we do need help. Do I just call a hospital, or do I just Google up, or do I just figure out through Just Dial reviews? How do I reach out to the
All
right?
of the above.
All of the
All of
above.
that. And it really helps to talk to a friend and get a
Mm,
personal reference. It's
mm,
also equally helpful to go on Google, read publication or papers, or if you've heard from somebody that somebody comes recommended, you start somewhere. Even with a doctor, you don't stick to one doctor that you go to the first time. You take your time to identify where the alliance and where the trust and fit is built. So even with a therapist, it's very important we work within a relationship that we will build with a client. And that kind of an alliance is absolutely important to us. And for that to happen, the person has to come to us, give us time. We give our time and resources and attention as well. takes some time. Or a lot of people prefer to go shopping for therapists. And that's a term I heard recently, that I'm shopping for a shrink right now. And I found it very interesting. I wasn't dismissive or judgmental simply because I think everybody has a right to go ahead and look for what fits them, what suits them long term, what sort of even framework works for them. So yeah, you start somewhere.
Right. Thank you for sharing that. Preeta, I would want to ask you, my next question is, how open do you one has to be? And these questions might just seem very, very simple, but I think these are some things that we feel that, let's say there is a 25-year-old girl who's gone through counseling, who has an underlying condition. Now she is probably going to get married. How open she needs, does she have to reveal that to her prospective spouse, or it's an arranged marriage? And considering the kind of taboos that we have in terms of labeling people who have mental health issues, uh, is it important or is it not important?
So, Varija, this is a very personal opinion. I would say this is an opinion on my part. Is to, when you get into a relationship, the best thing is to be honest and open. Okay, I say this because today, if you have a mental health issue, a very simple, maybe you have anxiety and you have panic attacks. I'm talking about very simple, the simplistic, that something can be managed, don't have to go to take medication, but can be managed sometimes at home by doing home remedies, techniques, following some techniques. It is very important to let at least your spouse know. I do not advise you publicly going and telling the entire family, but the trust where your spouse will be your biggest support for the rest of your life, your life partner, it's very important to talk to this person openly and see where your relationship may stand in the future. I say this because when you enter into a marriage and you enter into a family, there are a lot of other stresses, the change of lifestyle, the change of home, the change of living with other people, demands of a family life may actually trigger these anxieties also. Okay, and at that point, if you're not able to manage and your spouse is not aware of it, you and your family will be blamed for hiding something, and you may not get the required help that you need. So it is very important to get into a relationship with honesty. If the spouse does not understand, or this life partner does not understand, I think then it's not the right match. And if the person is open, educating the person, talking to that person, researching things with the person is very important. That's my opinion. But I think everybody may have different things to say about it.
No, I think that's a brilliant suggestion in terms of having your spouse stand by you, and especially when you are going through something where you need maximum support from your spouse or the spouse that you're planning to get married to. I think that's a brilliant suggestion. I want to ask you,
Uh,
Dr. Yeah, Sindhu, you want to
I
add?
also wanted to just add to Preeta made some brilliant points, and I wanted to say that in the recent past, I've experienced a growth in the number of couples that come before marriage to understand mental health issues of the other partner, and it is such a positive thing because it not only builds trust and environment of support, but nobody is also immune to it. So it's not just one partner who has got a diagnosis. Tomorrow the other partner or the spouse may also have, say, vicarious trauma or his own or her own anxiety issues. It's so important to have premarital counseling from the perspective of mental health then. So just like we ask people how much do they earn and where do they have, where, what kind of a house do they live in, helps so much to reveal this most crucial information. What am I struggling with? The sense of me. How do I relate to the world? And if I'm struggling, will you be a part of my journey? And then the therapist comes in and builds the journey.
That's such a beautiful suggestion, and I hope a lot of people take this seriously. I also want to ask Dr. Kinger about, let's say somebody's identified that they have stress, they've gone through a treatment, and they are okay now. What are the chances of relapse, and what are the chances that is it is it always that for the rest of their lives they are in that vulnerable situation that they have to keep coming back to you, or is it like a constant relationship between the counselor and the patient? How does it work?
Are you talking about stress, or are you talking about a specific
I'm
diagnosis?
talking about depression for now.
Okay, so for example, if you have a depression, there are different types of depression, like we spoke about unipolar depression or a bipolar disorder or cyclothymic disorder. So there are various categories. So depending on what you're suffering from, once you have taken your therapy and treatment and medication, etc., there's a very limited chance that you'll have a relapse. But there's a possibility of a relapse, because suppose you are doing okay. It's Let me give a very simple example, like Preeta spoke about an orthopedic. So you have slipped and you've fallen and you have a fracture. So you go for your plaster, and you are laid up in bed for 6 weeks, and then you become okay. And 5 years down the line, you slip again and you have one fracture again. The two are not connected. You had a fall. So similarly, psychologically speaking, if something really drastic happens, so for example, the last time you went to a depression because your marriage broke off. That's why you went to a depression. Now, this time you could go into a depression because you lost your mother, whom you really depend on, or you really love a lot. And so it's a sense of loss. So the loss of the mother could kind of trigger a reaction. But this is not true of everybody. So that's the reason it's not true that once you are in therapy, you have to be in therapy for the rest of your life, so on and so forth. I think most, so if you look at CBT, I think they normally it's advised 12 sessions or 18 sessions on depending on the client need and so on and so forth. But there are a lot of people who want to continue therapy. You'll be surprised that there are a lot of clients who, once they come for therapy, not only do they send their friends and family, but they want to continue therapy because they feel that this has helped them grow much better, or they become much better human beings. So I think it's a very, very unique and individual process. See, I don't think there are generalized thumb rule answers, which it's like not one size fits all. It varies from person to person, case to case, depending on the severity, as I said earlier. So I think everybody should just keep an open mind. The client should keep an open mind. The therapist should keep an open mind, and family should keep an open mind. And if you really need it, I don't see what's the harm in going back, because you need to get back on track and live your life fully, completely, holistically again. So I would look at it, even if you come back and it helps you to lead a better life, it's good for you.
Right, right, absolutely. I completely resonate that. And Preeta, I was very recently reading somebody's comment on the group. It's a mom's group on Facebook, and now, in the current times, a lot of families are curtailing their expenses, and there is a general sentiment of, being low and not no celebrations happening, no marriages happening, no grand celebrations happening. And somebody had commented that, I had prepared a cake and I wanted to decorate the house and I wanted to do this, whereas the husband was not up to it. Now, in such a situation, and I could figure out that, from the tonality of her comment, that she was extremely low. Now, in such a condition, these are very obvious situations in our lives where, we want to do something, but the other person is in a different mood altogether. So, and while I understand that somebody's sentiment is low, you don't want to pretend that you're okay sometimes, right? So, in such a condition, what would you suggest to these two people?
So, Varija, as you rightly pointed out, that you have to be very sensitive to your surrounding, your specifically your family members when you're together. I mean, me and my husband are in a house, and things are okay with me because I am maybe just a housewife. Things are fine, but for him, it may be a lot of stress at work. A lot of things happening at work, and he may not feel it. I think do not deprive your own self from being happy. You can do small things for yourself. For example, you can make a nice dish just for yourself, for the entire family. That is very important. You can read a nice book for yourself, or watch a nice movie for yourself. What I'm trying to say is, do something that makes you happy personally. The other person may not be wanting to get involved in it, and that is absolutely okay. And it would be very, very considerate of me to consider that. And yet, keeping the essence of it, I keep myself happy. So do things that makes me happy. Maybe buy a small thing. It could be ek mithai ke dukaan mein jaake, pick a mithai and buy, your favorite stuff. I mean, really, really small stuff. But do not deprive yourself. I is important, as well as everybody else. If I am okay, everything around us is okay. That's very
Absolutely.
important.
Absolutely. And I think that acceptance that I am okay and I am not okay, I think that is the starting point for all the solutions which we're talking here today. If you're not okay, admit that I am not okay, because only then you'll try to find solutions to make yourself okay. Dr. Kinger, I have a question here from Summer, which I am flashing below. Do all autistic kids need to take sorry, I can't pronounce this. I
Risperidone.
think yeah, it's a medication, and if no, is it self-injurious behavior? Would you like to take that up?
So, yeah, I just want to say that it has been prescribed by a psychiatrist. It is not for self-injurious behavior only. So, kids have a lot of attention issues. They may not be paying attention to what's happening to the surroundings and all. And this medication helps them to focus and probably perform and do better. So, I think the right person to answer this question would be your psychiatrist. And if you're not happy with your psychiatrist prescribing it, you can always go take a second opinion from another psychiatrist.
I hope that answers the question, Summer. The next question we will take up, Preeta, if you want to take this up. So, how much does parallel medicines like Ayurveda and homeopathy help in stabilizing one's mood or stress or anxiety?
So, Varija, I don't know how much research is there out there supporting this kind, like Ayurveda, homeopathy, and moods. But I'm sure it does help in some degree. But what really helps, in spite of therapy, is willingness to do something about yourself. So even if I'm having medication or I'm going to the therapist, nothing will help you unless and until you're willing to make those changes within yourself. That is what I would tell in mental health issues. I mean, actually, like for example, stress and anxiety can be managed, if it is at a the mild level, can be managed at home by doing yoga, by having a mantra, or things like that. Small things along with your medication, or along with these alternate medication. So I don't know how much support is, how much medical support is there, or research out there. That's what I would like to say.
Right, rightly addressed. Sindhu, we have this next question, and something that we spoke very early on, that does India, so even though we are trying to reach out, but are there enough psychologists to do justice to our mental health, and enough qualified psychologists, if I were to ask
See,
you?
the second part of your question is so correct. We do have a lot of people who call themselves therapists or psychologists. Do we have people who are practicing evidence-based therapies, science-based interventions? I get calls from, I mean, I have people who tell me that they're a therapist, and I said, what sort of framework and what do they practice? So they said massage therapists, and they apparently also deal with various psychological issues. The point is, look, in India everybody calls themselves therapists. We need regulation. To answer the question, though, I do not know the actual number, but I can tell you 100% not enough psychologists right now. We have
Yes,
a
so,
huge
so
void in mental health professionals in India right now.
So
So
according
which
to
Can I add to
WHO,
that?
we have
yes,
1 is to 6,500 patients. That's the figure.
Varija, can I add to that?
Yes, Dr. Kinger.
So actually, India is a ticking time bomb as far as mental health is concerned.
yeah,
Okay, so we don't have too many people, one, and B, even the people who are there are largely concentrated in metro cities. Tier 2, Tier 3 cities don't have too many good professionals or people who are adequately trained. And for the rural India, which is really, which is where a large majority of our people who are struggling and living are really struggling. So I don't think we don't have enough,
yeah,
but to look at the other point of view, we also shy away from. So if, whether we have enough or not is one part of it. Do we seek it out enough? That's the second part. So whoever is there, whether we access those people, that's the key. So I
right,
don't think we have enough people to address the concerns of this huge nation, but I think metros definitely have a larger number of people, and I think we are fortunate to have them in metro cities. And today with things like WhatsApp video and other online things, people from different places are able to access. So I think gradually, the as the awareness is building, people are reaching out. So I don't think we have enough, but I think if whoever is there, if they can be accessed, and people who are struggling, you bring your friends, you bring yourself, I think it's good enough.
There's the next question, which I think, Dr. Kinder, you will be able to address this best. So, uh, I would like to ask about Alzheimer's, and my question is the disease genetic, and how can we help a person suffering from the same?
So Alzheimer's is a neurological disorder which is triggered by age. As a person ages, the brain functioning, the memory functioning, so there are certain cells which don't function well, and as a result, the person's day-to-day capacity, memory, attention, focus gets affected. They lose the sense of time, place, person, and it's a progressive disorder. So a person who's suffering from Alzheimer's needs to be on medication clearly 100%, because that helps to slow down the process or the progression of the disorder. And there are therapists who work with old people. So these are people who work exclusively with old people, geriatrics. They work in the field of geriatrics, and they're able to do activities which help these people to be in touch. It's like solving problems, puzzles, reciting nursery rhymes, and various other things. So what happens is, over a period of time, the person functioning will definitely deteriorate over a period of time, but the process is slowed down.
Thank you, Dr. Singer. Sindhu, I want to ask you. So, we've been speaking a lot about, offline, we've been speaking a lot about autism, and we've been speaking about ADHD. And I have been coming across people who are recently diagnosed with mild or borderline ADHD conditions, and probably it was never diagnosed for the rest of their lives. Now, again, a question like that, is this something which develops over a period of time? Is this genetic, or is it something which can be managed? And if so, how? And what are the trigger points?
what are
Or
the
what are the trigger points? How does it get triggered, if at all?
So one thing we know is that there is hyperactivity, there is attention deficit. We also know that it's a childhood, a disorder that very often comes in childhood. There are behavioral issues. Your question specifically is about how is ADHD triggered, or is it genetic?
All of it. So is it one? Is it genetic? Second, if
I
it's
honestly wouldn't have, I wouldn't be the authority on it. I do not deal with children. So if I
I
could, Dr. Kinger.
bring in Dr. Kinger.
So ADHD normally is has three components. There is impulsivity, there's hyperactivity, and there's attention deficit. So there are three different parts to ADHD. Typically, all children are restless. All children run around. They don't focus on one thing. So normally ADHD is not diagnosed before the age of 6, and even when it's diagnosed very very carefully, cautiously, and putting the child through a certain series of evaluations and diagnosis. It's a neurobiological, psychological issue, and it needs to be really, we need to tread with caution. What you need to understand is all over the world, the number of kids who are being diagnosed with ADHD is increasing, and today it's assumed or it's hypothesized that almost 10% of kids are suffering from ADHD. So these are children who need special attention. These are children who may need occupational therapy. They may need remedial education. They may need counseling. The parents may need counseling. The teachers in school need to understand that these children are who are disadvantaged, and they need to be given special help and things like that. So actually dealing with ADHD is a different it's like a huge area in the field of mental health. So if we are going, actually if we talk about it, I think we'll talk about it from morning to night, and you'll still barely touch on the thing. So what I want to talk about it over, what I want to say over here is that ADHD is, yes, a big problem, and it is affecting children, and we need to really focus on it. So it's
Thank
not
you.
just a
Preeta, can
child
I
who's
add
being naughty.
something to this?
It's not a child who's just being naughty. It's a child who has a problem.
Preeta, you want to add on something?
Yeah, I just wanted to add something with what Dr. Kinger said is, and to answer your question, yes, it is genetic, but the severity of ADHD varies. There's a huge spectrum from mild, moderate to, absolutely severe and major. So there are certain triggers with ADHD kids or adults, and they are stress, they are anxiety, there is a lack of sleep, there is food and additives in our food that we take. We have to be very careful with them. There's overstimulation. I think what we don't realize is a child who is ADHD does not like loud noise, too much of too many people around them, very bright lights and things like that. But ADHD is manageable. So with medication, with therapy, and at home coping techniques is very, very manageable.
Preeta, would you also want to take this next question, which talks about is split personality for real? Because there are people who might just act normal at one point, and at next point, their behavior changes. And I want Sindhu's reaction also on this, but we'll start with Preeta.
Okay. Varija, yes, split personality is does exist, but how much we don't know. But from what this question tells me is this person has severe mood disorder. So one day he's fine and one day he's not. Yeah, split personalities
So we
definitely
also
exist.
call it dissociative identity disorder.
Disorder.
A lot of times in the cases that I have encountered, I've seen it comes with a history of severe trauma, complex PTSD, dissociating with the personality or splitting could be one of the coping mechanisms they might have come up with in order to process it. So there is definitely DID, dissociative identity disorder, or what people call, split personality. It is there, if that's the question. Varich, is there an
Yeah,
additional
yeah, yeah.
question? Okay.
Yeah, there's an additional question which want to. I would, if it's coming on your screen, yeah, how to deal with chronic episodic stress and how to avoid the feelings of suicide feeling, as how to find that person who is going through the stress. Dr. Kinger, would you want to address this?
I think we all will address this because we may have
Please.
different points of view. I think when you say chronic stress, it definitely needs handling, and you need to actually identify the source of the stress, and you need to make sure that you alleviate it, reduce it, or learn to manage it. So when you talk about feelings of suicide, I think suicide is an outcome of intense depressive feelings or a depressive state, or a sense of hopelessness, helplessness, meaninglessness to life. You may have a lot of anger outbursts. You may feel out of control. You may feel nobody understands you. You may feel nobody cares for you. There's a sense of anger with the world. There's a sense of anger with the self. So there's a huge amount of anger build up which happens. whenever a person is either talking about suicide or wishing for suicide or fantasizing about suicide or getting thoughts about it. So I think it's one of the things, whenever you feel or you think that this is happening to you, the best thing is to reach out to one a mental health professional. That's what you can do.
Absolutely.
Sindhu, you want to take that forward with your
Uh,
thoughts?
I agree with you need to reach out to someone if you're ideating or if you've been ideating suicide, ending life. Look, at the end of the day, people they want to end pain, right? So the anguish, pain, hopelessness. So a lot of times they ideating suicide as a way of ending that pain. Now, contrary to popular belief that suicide is sudden, it's actually not. There is a prolonged exposure and manifestation of various behaviors and attitudes and there's communication that the person who's helpless is letting out to the world. Now, that's a very healthy thing that they want to be helped. So, avoiding the feeling of suicide means that you need to establish three things. And I tell this very simple, to a layman, I would say to remember three things. Manage three P's: person, people, and processes, which means the person that you are, what is the sense of self, what do you believe in, whether it is spiritual, emotional beliefs, what counts to you, what is meaningful to you, add that. What is your purpose every day? Add the processes, exercises, connecting with people, going out, keeping a job, doing creative pursuits, any process that helps you. The third one is people. How are you connecting with people? How are you maintaining relationships? We humans are hardwired for social connections. And just looking at these three P's, so I always start by saying manage and balance these three P's. So there would be a stress reductive effect. And it usually helps. Everything else helps. Yoga, talking, walking, running, finding a purpose, laughing. So I hope that helps. Hello?
Brilliant. So we've got the three P's as a magic wand from Sindhu. Thank you for those three P's, and we'll definitely run that again once we'll see this video again. Preeta, I want your thoughts on this issue about suicide.
So, Varija, my colleagues have rightly put a lot of things in place, and I would begin by saying that a person who feels suicidal often feels that he is alone. Nobody understands him, nobody understands his pain, and he has nobody to talk to. Well, I would like to stress and tell this person who's come up with this answer that you are not alone. We all feel lonely, we all feel helpless at some point. The key to this is that to reach out to somebody, talk to somebody about it. How can you manage this, or how can you avoid the feeling of suicide? Is first and foremost is to do not lose purpose of life. Your purpose of life has to be the focus point for you at this point. If you're feeling that your life is worthless, no, you're wrong. Your life is very important. You are important. That is the first thing one should keep emphasizing and telling oneself, that you are important to somebody. It's not that you are not important. You are loved, you are wanted, you are needed. So you do not stand alone. There are people around you who want you, need you, love you, or care for you. So that helplessness, that's the first thing to deal with. The other important things with stress, that you feel suicidal, you feel helpless, is sleep enough, eat well, you know um, please exercise, maintain a schedule in life, make sure you pick up a hobby, make sure you help somebody. Helping someone, paying forward, actually brings back empathy in you, and you start feeling these the people who feel suicidal have stopped feeling for themselves. They are numb right now. They feel the pain has gone so much, that's the best thing to is to end their life. But it is not that way. So please hold on to the purpose of life, and remember, you are loved, you are wanted, you are needed, and someone somewhere cares for you.
Very beautifully put, Preeta. Yes, life is important, and at every point, I think we have to make sure to remind us that it is something precious that you're gifted with, and it's not in a wiki that you can find all your answers. It's a process, and you have to live through the pains. You have to live through the joys in your life, and find the bigger purpose of your life. Another question that is coming up again, and this time I want Dr. Kinger to address me, because we are facing a lot of people around us with regards to dual personalities and split personalities. Now, one, do they exist? Is it for real? At one point they behave differently, and at next point they behave completely opposite. And do such people need help?
See, if I think there's a slight confusion here. I don't know whether he's talking about multiple personality disorder or he's talking about schizophrenia. So if he's talking about multiple personality disorder, it's very rare. There are very few cases in history which talk about multiple personality disorder. But yeah, there are people who may be going through a psychotic process. So they are normal for a few days. Suddenly they withdraw. They don't talk to anybody. They don't interact with anybody. They stop going to work. They become abusive, aggressive, whatever. So there are behavioral changes, there are sleep changes, there are appetite issues, they fly into a rage, and so on and so forth. So I think the best thing is that if you have somebody like this in your family or in your environment, take them to a psychiatrist or a therapist or a psychologist, and they will look at it and actually help you diagnose it properly.
Thank you, Dr. Kinger. I think the follow-up question which you answered earlier about Alzheimer's is, what can one do in their life earlier? So can we prevent Alzheimer's at an old age? Is there a possibility?
So, well, aging is a natural process. As you grow older, some of your cells die. Actually, our cells die in the body every 30, 40 days. So, actually, you have a new body every 45 days. You're not the same person you were 45 days back. Certain cells, so that's a fact. So, there are certain cells in your brain die as you grow older. So, what can help you is, like I think all of us have been saying, exercise is a very, very important factor over here. Exercise helps you to slow the aging process. Diet is very, very critical, whereby you manage, eat the right nutrients, making sure that your blood pressure, your heart rate, and your general health is good. That's very, very critical. Sleeping enough is very important, because when you sleep enough, the brain refreshes itself and your functioning is better. So it reduces cognitive decline. Making sure that you take your vitamins, nutrients, so on and so forth really helps. Eating fresh vegetables and fruits help. Talking to people or having a creative hobby or doing things, having a more complete life. So we don't become crazy chasing money, success, just non-stop running after things. But if we live a more holistic life, I think that's one way. You can delay the process. You cannot prevent it. You can delay the process.
So that
Varisha,
that
I
was
would like to
yes.
add something here.
Yes, Preeta, go ahead.
Yeah, so there is a new research that has surfaced recently, that turmeric helps in slowing down Alzheimer's and dementia. So, as we Indians use a lot of turmeric in our food, so continue doing that.
Right.
And secondly, is keep your brain active. That means play a lot of brain games.
Right.
Those are
Enhancing cognitive functioning is so important.
yeah, so even if you have your phone and people think that you're always playing a game, play an intelligent game, and that will actually help you delay the process of Alzheimer dementia, if at all you have that.
So we have a very interesting question, and I know the answer to this one, but I want all three of you to answer this, which is, can psychologists also go into depression, and if so, what do they do? So, Sindhu, you want to start with your experience of being a psychologist? How do you deal with
Yeah,
it?
none of us have this force field or a magical protective shield. All of us are immune to mental health illnesses just as much as anybody else. The only differentiator is I would probably apply what I teach other my clients and patients. So I would probably practice more what I preach. But again, yes, they can. If the question is, can they go into depression? Yes,
So
any of
I
all of us can.
can I add over here?
Yes, Dr. King.
What I want to say here is that being in the profession has made me so humble. I feel anybody can go into depression, anxiety, and have a mental issue. And but I also think that human beings have immense strength to be able to fight back and regain whatever they have lost. I have complete belief that if you really focus on yourself and you really live up to leading a very authentic life, where you're true to
Hmm.
yourself and when you're true to your belief system, it definitely helps you to lead a very, very qualitative life. But as Sindhu said, psychologists are not demigods or they are not gods, they are human
Hmm.
beings. And they can actually end up. And I happen to have myself seen at least 7 psychologists who have come for their own mental health issues to me. So I know
Correct.
I think it's a fact that even psychologists can go into depression, definitely. Depression, anxiety, whatever it is.
Hmm.
I think more so because it is very draining to even deal with somebody else's stress. I mean, of course, you're professionals, but even if you are around with a person who is going through depression, to constantly motivate that person, you have to self motivate yourself. And I think that's where hats off to all of you, how you managed to do that. Preeta, I want your thoughts on this.
So let me self disclose over here. So when I initially got into this profession, constantly it was drilled into us in classes how to draw a line between your personal and your professional life, because they
Right.
overlap and they overspill. You can take other people's stress, distresses and sadness back home. So we are trained constantly, and over the years we have learned to switch off. So when we are with our client, or we are 100% with them, and then once it's done, the session is over, we switch off. The key to this is having a very balanced life yourself. One must be, and this is for everybody, this is not for just me because I'm a psychologist, this is for you, everybody around, whoever is there, is to keep a balanced outlook towards life. If you are happy at home, if you're happy with yourself, if you're able to balance everything at home, and I'm not saying you're going to do it every day, we also have our ups and downs, but the key, the underlying essence here is to have a balanced life. So tricks and tips that we give other people, we apply it to ourselves also. We
Absolutely
exercise, we
agree.
sleep
Yeah.
well, we eat well, we entertain ourselves. So after a heavy session, we'll probably go and listen to music or watch a funny show. We don't want to watch violence or any of that stuff, so because it's too much for us.
So, Varisha, I just want to add here. So, we follow a process of attach, detach, and reattach.
Hmm.
So, when a client
Correct.
comes to you, you get involved in him, in his process, in his life. So, you get attached. Moment they walk out of your cabin, you detach. Till the next time when they come back to you and you reattach. So, when you
Hmm.
follow this process, you will maintain a balance.
I think that's a perfect suggestion for all the people and the family members who are dealing with, family members who are stressed or depressed. I think before that, the stress bounces onto you or has a rub off on you, that's exactly what you're supposed to do, right? You're supposed to attach and then, recoup your own self so that you
Hmm.
can give that positive energy to that person. So we'll take that from you, Dr. Kinger. I think that's a good takeaway for all of us. The next question we have from Yathansh, and now that is something that I've never thought of, but yes, there are people who want to who want to be first and who want to progress faster, and they're very extremely ambitious and they want to probably push you behind. And I, in fact, sometimes I also look at psychology of people, especially in India. When you're standing in queues, there are people who break the queues and they want to go ahead. The flight is going to take off at the same time, or or the train is going to go at the same time, but you want to be the first one to go. They'll break the queues and they'll go ahead. And similar to what Yathansh is saying, so Sindhu, would you want to add your thoughts here? What about the people who want to have that competitive advantage all the time, and they want to be first and they want to be better than you, they want to achieve faster than you? I mean, is there something in their childhood that has triggered this behavior, or does it have anything to do with any condition, or clinically do you think
Uh,
you explain this?
First, I'm struggling to understand the question.
Hmm.
But if you're indicating whether the need to be ahead is a disorder, then no. I
Hmm.
am trying to interpret if the person is asking about the idea of perfectionism, or are they asking about the just
No,
advantage, just ambition, or
no.
not being happy with what they have?
No, so the condition is, so let's say how I can relate it. So let's say I'm standing in a queue at the airport,
Hmm.
and there are people who are constantly, they don't want to stand in the queue.
Hmm.
They don't want to wait for their chance, and they would always break the queue, ignoring that the queue really exists.
Lack of civic sense, poor manners.
uh how about people who are trying to behave in a similar way in the corporate world? They are probably trying
Well,
to. Hmm.
it broadly anxiety. I
Hmm.
mean, it could be if I have to oversimplify this and just put it under an umbrella, I would say sounds like anxiety. The person might have generalized anxiety where he or she is worried that something is slipping away.
Yes.
So wants to get ahead. The feared outcomes are far too much than what they think they have the internal resources to cope with. So they're constantly in a hurry. So sounds to me like what can be put under anxiety. But again, this is a question which is open to so
It's
many
a very
interpretations.
open-ended question. It's a very
Yeah.
open-ended question. I think what he probably the question implies here is that you're in a hurry to reach somewhere. Now the point is, I mean, you're running your own race. I'm doing my own stuff. You're doing your own stuff. Now, if you're in a hurry to reach somewhere, I mean, a point will come when you'll either feel exhausted or you feel you've arrived. Now, when you feel exhausted, you're going to slow down. When you feel you've arrived, you start looking and wondering what you need to do in life. Now this seems more like an existential kind of a question. I don't think this has very very simplistic answers over here. You need to understand the background of this. And when I want to say over here that I was reading somewhere that in Sweden, if you go to somebody with a project, they sit on it for 2 years. They don't do anything about it for 2 years, and after 2 years, if it's still valid, that's when they start taking action. So actually, there's no need to hurry. There's no fire burning anywhere that we are trying to go and douse.
Right.
So let's enjoy our life while we're living it.
Right, beautifully expressed. Preeta, there's this next question I want you to address this. That is, expression of depression different for introverts from extroverts, and who can easily and freely talk with others? So there are people who are very self-explicit about their feelings, while there are others who are not. So,
So,
would you? Yeah.
So, Varija, I think people who are depressed normally are introverts, are not extroverts. Because if you cannot share your feelings, openly to people, or say, you normally become depressed. You are bottling everything up inside you. So, I think from what I understand, that if expression of depression is different, yes, if you're an introvert, you are feeling more depressed than people who are extroverts. And not to say that people who are extroverts are not feeling depressed. You could be very happy in front of others, but yet not sharing your feeling. But yes, the inclination is towards people who are more introverted personalities, feel more depressed than extroverted, because they can't speak their mind out. And I think my colleagues may add to it too.
So I think introverts are people who have not learned to trust getting a favorable response from the environment, or they have hesitancy in expression. So many times when they come for therapy, they will take little longer to open up, because somewhere they have not they don't use language as a tool to communicate. But as therapists, we are trained to look at body language, the tone,
Right.
the way they walk into the cabin, the way they posture themselves, and things like that. So there'll be other cues which help you pick up. So expression or depression. See, depression basically is a disorder. So the expression will largely, we said, you'll either sleep too much or you sleep less. You'll eat too much or you'll eat less. Hopelessness, helplessness, worthlessness feelings
Right.
are common. Feeling that nobody understands me is common. Preeta made a very valid point, and I think I want to highlight that many times we miss depression in extroverts. Actually, there are a lot of extroverts who may be actually depressed, and they do random stuff, too many things continuously on the go. Actually, that could be stemming from a feeling of they start many projects, they will not complete those projects, they'll have hundreds of things going in there. It's like juggling 100 balls at the same time,
Mm.
and you're not really seeing any project to fruition. So what this is a very, 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 very interesting and an important question. I think the expression is different, but if you go to a good professional, they'll pick up what's happening over there.
That's correct. And for introverts, you have to understand depression by its very nature is an illness of withdrawal. So, which means people who have a dimension, a personality dimension as introversion, they are isolating themselves far more than before, and they're okay with it. So we have to, a clinician would be using a mix of diagnostic tools to understand depression. Now, I agree with Dr. Kinger's explanation on how difficult and challenging it can be for extroverts, because you wondering what's wrong. There seems nothing wrong with the person. They're talking, they're partying. How can it's? I'm sorry, but I need to bring Deepika Padukone. One of the things what happened is when she came out and spoke about her depression, my family member said, but she's got everything. She looks so happy. That's how we looked at her, right? We looked at her as a person who was constantly engaging with the social society outside, giving interviews, being happy, and just, and how can somebody like her have depression? So that's more challenging, as Preeta pointed out.
I think from both fronts, very beautifully, I think you've expressed that introverts don't express maybe because they've not got the right kind of shoulder to express, in terms of they've not developed that level of trust where they can vent out their feelings. Whereas for extroverts, they might just be going through depression, but to the world, they still might be over pompous in in their behavior, just to show that we are okay, and they are the
Mhm.
confident lot, and but inside they might just be breaking. But we've had a wonderful session today, and to all the viewers who've joined us now, or you want to see the repeat broadcast, there is a number which is scrolling at the bottom of your screen. If you want to reach out to any of these eminent panelists who've given their time today and who have actually enlightened a lot of my thoughts, along with so many others. So please reach out to them, send in a message with your name and details and what exactly you're seeking for, and they will fix an appointment for you. And thank you, Dr. Kinger. Thank you, Preeta. Thank you, Sindhu, for squeezing in time out of your busy schedule. I know that all of them have been going through crazy schedules during the lockdown, addressing people. We spoke about healthcare professionals. We spoke about teachers, they're going through depression. We are talking about students who are going through depression, professionals, and I've been hearing from you every day. Any final thoughts, Sindhu, that you would want to say to our viewers?
Nourish to flourish, nourish yourself, whether it's mind, body, anything. Keep at it, continue your inward journey. Nothing else really matters. And never hesitate to seek help.
Nourish to flourish. Thank you, Sindhu. Preeta, would you want to say your final thoughts before we sign off?
So my final thoughts are as our topic is, it is okay not to be okay, and to bring it to your awareness, I think we have to be grateful for what we have, instead of craving for, other things that we cannot control in our life. We should be very, very grateful. We should be living in the here and now. We should live in the moment. We should enjoy the family time that we are able to share with each other at this point. This negative situation of lockdown can be turned into positive. Learn something new, have a passion, do something you have never done before. Enjoy your family, enjoy your friends, because things will end. Nothing is permanent. The only thing permanent is change. So live with that and have a purpose in life.
Yeah, so I am doing something which I've never done before, which is hosting a webinar on mental health, taking
And you have been
inspiration.
absolutely brilliant.
You're
Thank you,
brilliant.
thank
Yeah, you're
you,
very, very good.
Thank
thank you. Yes, Dr. Kinger, one last thought from you before we sign off.
So I think my thought will be that we've been given this life, and we can all create a better story around our life. So how whatever life I'm living today, I could look at it in a particular way, and I look at it, how can I make it better? So, for example, if I'm only feeding my family, can I feed another child? If I'm going in a car, can I get two people in the car and give them a lift somewhere? If I'm only earning money for myself, can I do a bit for society? I think we need to all create a better life and not be so self-centered and self-obsessed and self-involved that we forget that there are other people out there who are much more complex and difficult situations. One of the stories I heard during the lockdown where everybody was saying that, oh, we have nothing to do. And then I heard a story where some people got together and they started cooking food for 100,000 migrants every single day. And this was all volunteer based activity. That means you can sit at home and crib, or you can take special pass from the BMC and go and cook food for 100,000 people who are struggling with their lives on the street, which will give a much higher purpose to life. So if we
Yeah.
all try to seek this higher purpose in life, I think we'll all be much happier, and we radiate the happiness around us. I think that's the thing. So I want to say that please look at your life as a golden opportunity whereby you can create a better story.
Absolutely. I think giving is receiving, and that's exactly what our panelists are doing today. They are giving a lot of their time. They are giving their inputs, their the information about mental health. That is what you've done, and we wish you a lot of happiness in return and a lot of gratitude. I'm sure a lot of people here, a lot of their questions got answered, and hopefully certain sense of direction. And in case you did not, there's a number that is scrolling down your screen. Kindly reach out to them in case you think that they can help you in any possible way or initial sense of direction. And we sign off on that note that it's okay not to be okay. Let's start accepting that we are not okay if we are not okay, because that is the starting point of any improvement in our life. And tell people around that you're not okay, and there is nothing wrong, there is nothing vulnerable, there is nothing there's no stigma attached to it. I think if you are okay, the world around will be okay. Thank you so much to our panelists. Thank you so much to our viewers. Hopefully we'll come back soon with some more information and some more insights. Thank you.
Thank you
Thank
very
you.
much.
Thank you, Varija, for doing this.
Thank you.